Good morning, everybody. Thank you for coming to the third annual Synapse Roundtable. My name is Michael Graglia. I am the Managing Director of the Syngap Research Fund, and it is such a thrill to welcome our incredible speaker here today. In the interest of time, I'm going to hand this over to my colleague, Charlene Song-Rigsby, and let her introduce herself, and then our first speaker, Dr. Terry Jo Bichell. Charlene?
Great, thanks, Mike. Good morning. I am Charlene Song-Rigsby, and I'm the president and co-founder of the STXBP1 Foundation, and thrilled that we are having this roundtable this morning. I would like to introduce our first speaker, Terry Jo Bichell. She is the executive director of COMBINEDbrain, and she is going to be speaking on cures happen faster when unique disorders find strength in collaboration. Thank you, Terry Jo.
Thank you so much for having me. I really appreciate this. This is great. And I'd like to share my screen. All right, it worked. So far, so good. And now, can you see my slides okay?
Yes.
So, okay. So as Charlene said, I'm the founder director of COMBINEDbrain. COMBINEDbrain is a consortium made up of, at this moment, 26 separate patient advocacy foundation organizations, which you could see represented here behind my head and also on this slide. I founded this because I'd been working in the Angelman field for quite some time, for about 20 years. I have a son with Angelman syndrome. And what I found out in the past, that things have been changing in the past 20 years, quite a bit. So 20 years ago, when he was originally diagnosed, it was really rare to get a single gene diagnosis for a neurodevelopmental disorder. We didn't really know how to collect natural history. We didn't really know how to, we didn't have an ICD-10 code for our disorder. We didn't know the morbidity and mortality rates for Angelman syndrome. We really had to dive in deep and find out everything we possibly could about Angelman syndrome. And in doing this, what we found, and there are a few other neurodevelopmental disorders that were also early diagnosed, Prader-Willi syndrome, also on the same 15th chromosome area, Duke 15, also the same 15th chromosome. A few other disorders that were diagnosed really in the early days in the 90s. And we, at that point, really were working hard to show how unique we were, to show that we weren't actually, we shouldn't be lumped in with autism or lumped in with intellectual disability, that Angelman syndrome was really special because, in fact, it had all these unique characteristics. And so now that 20 years have gone by and whole genome sequencing is happening, and we are finding more and more and more disorders that we can identify with a genetic mutation every single day. Now things have changed a little bit. And so now what we found out is we've got to do this fine line. We've got to work really hard to find out what is unique about each disorder, but we've also got to figure out what we can share, what can overlap, what can we possibly do that somebody else has already done, so we don't have to reinvent the wheel. And what I've been telling people lately is, you're special, but you're not that special. And what we really need to do is work hard together and make sure that we can help each other get to our cures faster. So that's why I founded COMBINEDbrain. Let me see if this will advance. Yes, it will. And it's a consortium led by patient advocacy foundations, because face it, even now, even with amazing clinicians, researchers in the field, really what we all need to acknowledge is that parents more than anybody else, are the leaders for rare disease research. Parents are the people who care the most about a disorder. Parents are the ones who can actually get the big picture of what life is like to live with a child with a disorder or a family member with a disorder. And so, in fact, these days, it's parents and patient advocates who are really leading the research for rare diseases. Of course, working tightly with the clinicians, the industry members, and researchers who are working on these disorders. But I mean, patient advocates are really key. So we are a patient advocacy foundation, and our mission is to fast track cures for all of these disorders that are part of COMBINEDbrain. And we have 3 represented on the roundtable today. Phelan-McDermott syndrome, which is represented by Cure Shank, and STXBP1 disorder, and SYNGAP1 mutation. Those 3 are 3 of the neurodevelopmental disorders that are part of COMBINEDbrain. And what COMBINEDbrain, our focus is on severe, rare, genetic neurodevelopmental disorders. The reason why we focus on that, there was a lot of work being done in autism. There was a lot of work being done in epilepsy. There wasn't very much work being done in cognition. And our disorders are all disorders that have severe cognitive disability. So this is why we are working together on looking for biomarkers and outcome measures for neurodevelopmental disorders. So when you think about, and I'm not going to read this slide, y'all have had plenty of time to read it while I've been talking. So if you think about cognitive disorders and treatments for cognitive disorders, I haven't had enough coffee yet, evidently. These are our members, current members. We do have a long waiting list that's building every day. And part of the reason for that is because there are new neurodevelopmental disorders diagnosed every day. So I do think that our membership is going to expand in 2022, but this is the current membership. Anyway, when you think about how, oh, forgot to tell you, these are the 3 disorders that are here represented today. So when you think about a neurodevelopmental disorder and how are you going to measure, how are you going to do a clinical trial? How are you going to cure it? How are you going to figure out if a treatment is working? What we did in the past, and we did in Angelman syndrome, we made a mistake, which was we put the rodent models in the center of the picture. So we did a lot of great research in the lab. And when my son was diagnosed, there were no clinical trials whatsoever for human beings. But there were clinical trials going on in the lab for rodent models. And we were all focused on those rodents and focused on those rodent models and what we could do to improve their lives. And so what happened was that we did find some great treatments for rodents with Angelman syndrome. We reversed the phenotype in rodents with Angelman syndrome many times. And when we did this and then moved those compounds or those repurposed drugs into clinical trials with human beings, our trials all failed. So what we realized is that we need to put human beings in the center of this picture. And when I say we, I don't mean just the people I'm friends with or even the Angelman community or even the rare disease community. The FDA realized that trials were failing, and not just for neurodevelopmental disorders, all kinds of trials were failing because patients were not put in the center of the equation. And so the FDA in 2017 and 2018 introduced some guidances which really try to explain to industry and researchers that you need to put patients in the process from the beginning. You have to find out, what is it like to live with the disorder? What is your day-to-day life like? What would matter to you as a patient or to a family to change if you found a treatment? So we have all these amazing genetically related treatments now coming down the pike, so many kinds. Obviously gene therapy, but also antisense oligos, siRNA, miRNA, CRISPR. We have so many possibilities for genetically related treatments that could actually really correct the underlying disorder beneath any of these severe neurodevelopmental disorders. And if it worked, if one of these therapies worked and it changed something, it improved something, what would matter to patients to improve? What could we measure that would show that quality of life is better for that patient and that family? So now what we do is we've got to actually find out what matters to patients first. It's one of these things that's so obvious, it just drives you nuts that people didn't do it before. And then we have to collect the natural history on that. So we have to ask questions about life that matters to patients on a regular basis over time, not just once right before a study, but over the length of a person's lifetime. Then we have to figure out which of those things can be measured in the models, the rodent models, even the cell models. And then we have to figure out what endpoints can we develop for trials based on what we can measure in the humans and the rodents and what matters. And then we do the clinical trials. That's how we get clinical trials to succeed. So this is what COMBINEDbrain was built to do. And by working with all the member organizations, we really help all these patient advocacy organizations identify that they themselves have the most responsibility and the most access to all of these parts of drug development that are represented above this timeline from, the gene ID to a cure before the FDA. So it's really at this point up to patient advocacy foundations to lead the charge for natural history. And really, this might be a little controversial, I hope not, but the patient advocacy foundations really need to own the data for natural history trials, because researchers come and go. Y'all get new jobs, you retire, you decide to move to another institution. Researchers come and go. Industry comes and goes. Clinicians come and go, but the Patient Advocacy Foundation, they are going to care about this disorder until it's cured, and then after it's cured, probably to help find patients and get them to the treatment they need. So natural history data, it's got to be spearheaded or coordinated, or at least owned, accessed by the Patient Advocacy Foundation. Plus, they're the ones who have the lists of patients. They're the ones who are going to recruit all the patients to get in the natural history and then to get in the clinical trials. And actually, if we do natural history right, natural history can be a control. This is the holy grail of natural history. We all got to work hard on that. And then disease concept studies and disease burden studies. These are really important in drug development. You have to understand, what is the burden of a disease? on a family or a patient. How, if a patient has a severe neurodevelopmental disorder, what has to happen in the whole family? Does somebody have to give up work? How many medical appointments are there? How much money does it cost? That's disease burden. And then disease concept, I'm going to talk about in a minute, is what the disease is like in daily life. And then it's really up to patients to give input to patient-centered outcomes. How are you going to measure if a treatment's working without asking a patient? So all those things are on the top of the timeline. And then everything below the timeline, that's got to be done really spearheaded by researchers, by industry, by clinicians, but they're going to need stuff from up on top of the timeline. So to get biomarkers, you're going to need biosamples. So you've got to coordinate for those. And same thing with everything else on the bottom of the timeline. So as part of our 2021 initiatives, we worked hard to get the foundational work done for all of these various components of drug development. And because time is short, I'm not going to go into details on any of these, but I hope that you can get a hold of me through the website, combinebrain.org, or you can email me. And I'm just going to talk about a couple things right now that we've been working on that are really pertinent. One is a biorepository. How are you going to get all those biosamples? I mean, how are you going to get those biomarkers without biosamples? And this is where I tell people you're special, but you're not that special, because it's a lot easier to work across disorders to figure out biomarkers. What proteomics can we do? What are there possibly byproducts that could go that are in blood that could go across a whole bunch of different disorders? Could you measure not just what's specific for the disorder, like gene expression, but also what might go across disorders like neurodegenerative products? So we need biosamples. So we've opened a biorepository that is open to any neurodevelopmental disorder, and researchers can access these samples at really the lowest cost you could possibly get by with in this field. We also do these conceptual models of disease. We do the draft of the conceptual model. And today we have on this call 2 disorders that have gone forward to do the fully the final disease concept study. So in a nutshell, what a disease concept study is a literature review looking at every symptom ever reported. And then, I see Mike popping up, so I better hurry up. And we ask every question that you can think of about what your daily life is like. And we add all of those symptoms to a big disease concept map. And from that, we draw all of our goals and objectives. So one of them showed that of our original 20 disorders, communication, especially expressive communication, was one of the #1 issues for every single disorder. And so we have a new initiative working with Duke to expand a communication measure called the ORCA, the Observer Reported Communication Measure, to 12 different combined brain disorders. Amongst those, the very first 3 are Syngap 1, STXBP1, and Phelan-McDermott is the 4th. And the reason why those are our first few disorders to be looked at is because when we did our disease concept models, we could compare the disorders to each other to see who was similar and who was different. And as the ORCA was actually developed for Angelman syndrome, we wanted to start out with the disorders that were closest to Angelman at the beginning, Syngap 1 and STXBP1, and then Phelan-McDermott. And so now I'm going to conclude my talk with asking if you have any questions. And did I leave time for a single question? Oh, you're silent.
Not really, but thank you so much. I think one of the reasons we asked you to kick this off is because we're so proud of being a part of Combined Brain, and the whole theme of this roundtable is collaboration. So this is a great opportunity for us to show our communities and our colleagues that we are working with you and all these great organizations on the screen to do anything we can to help our kids in the most efficient manner possible, because our kids are sick, as you rightly said, and we care deeply. Thank you so much, Dr. Bichell. I will see you soon.